Hello, welcome to the Gary Owen Show. You guessed it correct, you are watching Gary Owen. And today we are going to be covering 4 important topics. And that's going to be, number 1, when do you sign up for Social Security and for Medicare? Because so many people are asking us, they're calling us, they don't know what to do, where to turn to, how to do it, where to do it. So we're going to cover that, a very important topic today. Then one of her favorite, Kathy's favorite topics is prescription drug coverage. It's important to get that right. So that's topic number 2. Number 3 is going to be short-term medical and bridge to Medicare plans. You hear the hype about what is bridge to Medicare. Well, guess what? You're going to hear it today from Gary and Kathy. And then 4th, we're going to talk about protecting your money, having a safe money vehicle, capital preservation with a lifetime income. Before we get into those 4 topics, though, Kathy, we've been hearing a word of the day, or word of the month actually, the C word.
Yes, coronavirus.
COVID-19, right? So the buzzword of coronavirus. So the tip of the day today for you is don't travel to China, don't travel to Japan, don't travel to Italy. In fact, you might keep your rosy butts at home with a stay vacation. Just saying. And also, Kathy, I want to introduce our audience to Kathy Prosneiwski. Kathy is one of our field agents and works out of our local office in Stewart. Kathy, tell us a little bit about you.
A little bit about me. I am originally from New Jersey. I lived here on the Treasure Coast. It'll be about 16 years now. I have a bulk of my family down here with me, as well as a son who is in law enforcement and serving the community. And I am located in the Stewart office, so I'm glad to be here.
And we just got back, or I just got back from Washington, D.C., because there's a lot of issues that our clients are concerned about. So I am a member of the National Association of Health Underwriters, nahu.org. Check it out. So we have roughly 20,000 members across the country, and we had 700 members converge in Washington, D.C. Last week to meet with our legislators and bring up the topics that's on your mind, that you're concerned about. One of those topics is surprise billing. So obviously we know that is a big issue. Clients are getting balanced billed. They're getting bills that they shouldn't be getting because you go, in good faith, you go into your doctor who happens to be in network, but then maybe the anesthesiologist who's not in network charges you this outrageous amount of money. So we are talking about that, getting that straightened out for you. Another issue is COBRA. Many people are working later, then they go on COBRA, and then they realize now that they're maybe 68, they've been on COBRA for a year and a half, and COBRA is not creditable coverage. So we've been talking to our legislators of changing that, because if you sign up for Part B, after you come off of COBRA, what happens, Kathy?
It's delayed.
Yeah, and you get a 10% penalty, so that's not good. That 10% penalty is for every year you don't sign up for Part B when you first were supposed to. And a big one that you deal with every day is prescription drug coverage, and the affordability or the unaffordability of prescription drug plans that we see today. So I'm very proud to say that I'm very actively involved with NAHU, and we're bringing the concerns of our clients to Capitol Hill to get these issues straightened out. So we're very happy about that. So we're going to start with topic number 1, which is
when to sign up for Social Security and Medicare.
So I'll cover the Social Security part if you want to basically cover Medicare, right? When should a client sign up for Medicare? 62?
65 years old.
65, right? And what else? What if they're working?
They can delay. They can sign up for Part A, and they can delay their Part B if they're covered under any group coverage.
Yeah, so there's a lot of crazy acronyms in Medicare. SEP, AEP, OEP, DNSP, OMG, it drives you nuts. So we've been there before, you know it. So it's important that you contact a local Medicare professional who specializes in Medicare planning to help answer your questions, because trust me, there's a lot of questions and we hear them every day. So don't be shy. You're going to get a lot of confusing and conflicting information out there. Call the Medicare experts at Owen Insurance Group. Kathy and one of our 400 other agents across the state of Florida and across the country can certainly help answer the questions you might have. But it's really important to get your Medicare right. But yes, so Typically, if you are not taking Social Security, you're 60, you're approaching 65, you're 3 months out from turning 65, and a lot of clients do this. They put their head in the sand because they don't know what to do or who to turn to. Don't do that. That's the worst thing you can do. So the best thing you can do is pick up the phone, call Owen Insurance Group, and we'll guide you. Let one of us be your guide to help you make the right decisions, because the choices you make today can last a lifetime. It's important to get it right the first time. So we'll talk to you about the choices you have in Medicare. But if you are taking currently taking Social Security, your Medicare A and B card will come to you automatically. You do not have to do anything. So if they are not taking Social Security, Kathy, what steps do they need to take to get their Medicare?
They can log on to medicare.gov and sign up there, or they can
SSA.gov.
I'm sorry, SSA.gov. Sorry. They can sign up via SSA.gov. They can call the Social Security building and speak to them over the phone, or if they'd like, they can make an appointment and go to a Social Security building.
Or they can send a smoke signal and hopefully that they'll get their answer responded to. But if you do go and you do walk into the Social Security office, make sure you bring a nice novel, because you'll be sitting there for a couple hours. So
yes, eat before you go.
Social Security, this is a big one. The two main issues that clients have questions about today across the broad spectrum across the country is, number one, their Social Security. Number two is Medicare. So those two are two key important components to your life, and you want to make sure that you get it right. You want to make sure that you do it right. So people ask all the time, Gary, should I take my Social Security at 62, or should I wait till full retirement age? So the full retirement age has changed, right? So it depends on the year that you're born. If you happen to be born between 1943 and 1954, then your full retirement age is 66. So that's when you get 100% of your benefits. But before that, you're going to take a hit. And if you do take it at 62, my God, you take a 25% hit, and that is for life. So it's important that you sit down and you strategize. We have a software tool called Social Security Timing. So we'll sit down with you and we'll plot out the best course of action for you. And for those of you out there that were born before January 1, 1954, there is a special planning tool available for those folks. It's called, it's for your spousal benefits, and it's called restricted application. So basically what you can do is the spouse can file a restricted application at a full retirement age at, say, 66, and then he can continue to work and earn money while his wife takes a portion of his Social Security. So there's a lot of things that you can do with Social Security, but you want to sit down and talk to one of our planning experts that can help you through that process. That's a big one. Delayed retirement credits. So what that means is when you reach 66, full retirement age, whatever that is, depending on the year that you were born, if instead of waiting and taking your Social Security, you may want to wait to age 70. And each year you wait, you earn 8% additional interest on your money. So if you wait till 70, basically you're going to make 32% more on your money. So I think it's important to figure out if it is good to wait or if it isn't. Typically what we see right now is about only 5% of the population are taking that route and waiting to age 70. Also, talk about Part A, and going back to Medicare for a second, because for those, how many hours or how many credits, quarter credits, should a client have to qualify for Medicare? Do you know what that is?
40 credits.
40, which is equivalent to how many years, Kathy?
10 years.
10 years. So you gotta have 10 years of work, right? To qualify for Medicare A and B. And just to let you know, because most people don't know, Medicare Part A is free if you have your 40 credit quarters, and that Part A value is worth $458 a month. So, and you get that for free. So if you haven't achieved your 40 credit quarters, then obviously you got to work a little bit more, and you can achieve that in your first month. So let's say that you've got 36 credit quarters. It's based on how much money you earn, and you can typically do that in your first month, but you got to get through that 1 year to make it your 40 credit hours. Kathy, let's talk a little bit about prescription drug coverage, because Kathy in our office is our go-to person for prescription drug plans. And we realize, we see this every day, that consumers, that is probably their number one issue. It's not so much about their Medicare plan, it's about their prescription drug or their Part D plan.
That's correct.
So what do you see as being the biggest issue that you're coming across, especially this past open enrollment period?
I think the biggest issue that I've encountered with clients was them just literally not knowing whether it be a standalone prescription drug plan or a Medicare Advantage plan that includes prescription drug plan. So that's why we always say don't take the road alone and let us be your guide, because there is more to a prescription drug plan than the lowest premium. You've got overall out-of-pocket expenses. Drugs are tiered. There's standard pharmacies and preferred pharmacies under a plan. A lot of people don't know the difference. And I think overall it is making sure that the drugs that you're on are covered. A lot of people, they just think that they're going to sign up for a prescription drug plan and their drugs are going to be covered, and sometimes they're not. And then it's outsourcing drugs as well. A lot of clients I found are using Canadian drugstores in Israel to cover the drugs that are not covered under their current plan. So they didn't know they could do that.
And goodrx.com. I mean, we're finding a lot of people going to that website to save money as well. Correct. But Kathy's absolutely correct. I mean, people are just arbitrarily signing up for, let's say, a Medicare Advantage plan, and not really knowing if that specific MA plan has the prescription drugs it's in their formulary. So that's why it's important that you find a guide, work with a Medicare planning specialist that can help guide you and make sure you're in the right plan. Because trust me when I tell you, when you get your first bill, you go to your pharmacy and it's $1,000 that we just had last week. A client has paid, they've asked him to pay $1,000 because he was not on the right Part D plan. So it's important. Now for 2020, what is the Part D deductible?
I believe it's $435.
$435. Now,
yes.
Keep in mind that every drug plan with every carrier is going to be different. It's based on the formulary, and also some of the Part D companies will pay the Part D deductible, or you're maybe only exposed to a fraction of that Part D deductible, or your tier levels, maybe tiers 1 and 2, right, aren't susceptible to the Part D deductible. So again, if you take nothing away from this, make sure that you talk to somebody who knows prescription drug coverage, because you want to make sure that you get it right. What about the donut hole? Everyone is, you hear this buzz about the donut hole. The coverage gap is basically called the donut hole. The donut hole did close for 2020, but you still got to pay 25% of the cost of the drug while you're in the donut hole. And once you've and by the way, that starts, it's called the ICL, or the initial coverage limit. Once you hit $4,020 up until the next $6,350, you will pay that out of pocket, basically 25% out of pocket. The coverage gap, basically what happens is the drug manufacturer will pay 70, the plan will pay 5%, and then you hit the catastrophic phase after 6350, and then what does your drugs cost? 5%, man. 5% of the prescription drug plan, or basically $3.60 for generics and $8.95 for brand, whichever is less. So again, we can't stress the importance of getting your Part D plan correct.
And Gary, just before we move on to, there are some plans that do not have prescription drug coverage. And if you need a standalone because you have a supplemental plan for your Medicare,
that's right.
Just because you're not on prescriptions doesn't mean you shouldn't sign up for Part D, because if you don't, you will incur a penalty.
Oh my God, another penalty from the government?
Another one.
Come on. our government doesn't penalize us for not doing something. So Part B and Part D, there are penalties if you don't take it when you're supposed to. And Part D is 1% of the national Medicare Part D premium, which is roughly $35, is a average Part D premium. So, and that penalty will last you a lifetime. All right, so it is important that you do take your prescription drug plan when you first become eligible, because unless you have a crystal ball, and if you do, please call me, let me know, because I'd like to touch it. But unless you have a crystal ball that says, I'm going to need prescription drug coverage 2 years from now, how are you going to know? What if 90 days after you become eligible for Part D and you don't take it, and now you need a tier 3, a tier 4, or 5 drug? You're kind of SOL. It's not good to be in that position. So, Kathy, let's talk about the buzz of Bridge to Medicare.
Yep.
What the heck does that mean? Bridge to Medicare.
Well, it is just that. It is a medical plan that if you're 60, 62 years old, it can reach, it carries you over until you're 65, until you qualify for Medicare.
So, Bridge to Medicare plans, yes, there's a company out there that has a specific Bridge to Medicare plan. And then our short-term medical plans that have a 3-year term limit. So basically, if you're 62, so for those of you, now everyone else, turn your show off, put the volume down, this wasn't for you, unless you're 62, 63, or 64. If you're 62 through 64, you need to give us a call, Owen Insurance Group, 772-210-1020, because there are options, affordable options for you other than ACA, also known as Obamacare, because some people did sign up and now you're outside the open enrollment period. Now you got to wait till November for January 1. So there are options and affordable options at that. So as Kathy said, if you're 62, you can get into a 3-year plan which bridges you all the way to Medicare. And I think it's very important. To give you an idea, if let's say if you're under 62, we're talking about short-term medical plans now, just to give you an idea of the affordability. For a 45-year-old male who's a non-smoker, a $5,000 deductible and 80/20 plan, it's a PPO on the Aetna network, $235 a month. So when I tell you there are options and affordable options out there for healthcare plans, there are. Yeah, there's a caveat. I mean, there's always, when it comes to plans like that, you do have pre-existing conditions that are excluded. So we got to talk about that. We got to talk about your prescription drugs that you're taking. So if you're fairly healthy and you're on minimal or no prescription drug plans, I'm going to tell you right now, you need to be on a Bridge to Medicare or a short-term medical plan. Call our office and we'll be happy to provide you a free quote and get you some additional information on that. What else do we want to talk about?
Well, I just wanted to also add that something is better than nothing.
Oh my gosh, 100%.
A lot of people live their lives thinking nothing is going to happen to them. They're healthy. Well, I thought the same thing, and I ended up in the hospital. But I had some coverage. And I was thankful for that.
Yeah, true. I mean, just to give you an idea, a major catastrophic plan, I'd say a $25,000 deductible, because if you go to the hospital, for those of you who have never been to a hospital and seen the EOB, the explanation of benefits and how much money for a hospital visit, I mean, you're talking tens of thousands, hundreds, 200, 300, $1 million, right? So even if you had a $25,000 deductible plan, at least you got something that will mitigate that big risk that you're having. And you just, listen, you gotta deal with it the best way you can. But even a plan like that, it's only like $90-some a month. So there are some affordable options, and call our office and we'll be able to help and set you straight on that and give you some good ideas. All right, our last point of the day. Yes. Holy Moses, the stock market, okay, here in the last 2 or 3 weeks. Roller coaster, okay? So in my young age, I loved roller coasters. Couldn't get enough of it. Now that I'm in my 50s, not so much, okay? So I kind of like it's fun going up gradually until it drops down like that, and especially if you're invested in the stock market. And those of us who are invested in the stock market, it's scary right now. And for those of you who are in your 30s, 40s, even 50s, I think it's still a good idea to be invested in the stock market and keep money in your 401k. But if you're late 50s and early 60s, you're approaching retirement age, it's a time now to be conservative.
Absolutely.
Conservative, all right? listen, if you're a Democrat, I'm not saying vote conservative, I'm saying be conservative with your money, okay? This is not a political view, so, but what's most important is that you have capital preservation and lifetime income. So we had a couple folks come in last week to see me. One lady, all she had was $50,000 in her across her 2 or 3 retirement accounts. So now we're able to protect that money and provide her a lifetime income. Another gentleman here came in to see me last Tuesday. He has $295,000 in his 401k. He's 65, so we helped him with his Medicare plan. Good job, Gary. And we put him in the right plan. And now he's asking about how we protect, because he's starting to see his 401k become a 201k. And that's disgusting, really. I mean, it is not fun to watch that and be part of that. So we can take that money and put it into a fixed indexed annuity. So what happens is that now, if the market plunges, he doesn't participate in the drop. So he keeps that money solid and safe and secure. If the stock market goes up, he participates in the increase, right? But it's a participation rate. So it may not, if it goes up 30%, of course, it might only be 75% of that increase.
So it's a win-win.
It's a win-win. Listen, as I said, it's really important to protect your money, protect your nest egg, so it doesn't become scrambled eggs, okay? We love scrambled eggs and bacon, but not when it comes to your retirement. So you want to make sure that you protect it. We can give you some ideas. To give you an example, this gentleman that came to see me with his $295, let's say that he starts taking distributions at 72, and based on the last 10 years of the stock market, let's say that this year it becomes 0. There's no increase because of what's happening with the coronavirus situation. And maybe next year it goes up 18%, year after that 0, year after that 23%, year after that 0, year after that 1.3%. So that kind of an idea, right? So now at age 72, he's going to have about, from that 290 or 295 will now become 425. And he can start taking distributions every year. But now let's say he's age 90. That 295, he just took $395,000 in distributions. And if he dies, and he still has $358,000 in death benefit. To me, that's the way to go. Listen, there's a lot of hyperbole out there about fixed index annuities and not doing it, or we're putting it into a risky retirement fund. I'm going to tell you right now, it's very important that if you're of a retirement age, protect your nest egg, okay, or what's left of it. So call our office and we'll be happy to give you some information at no cost to you, so you can be well informed. Well-informed consumers make the best decisions. Kathy, we've got like 2 minutes left.
Okay.
I know I said mostly everything, so anything that you want to say to our audience in closing?
Well, I just wanted to thank you to the listening and watching audience and Owen Insurance Group. We always say, don't take the road alone, and let us be your guide. And just to let you know, Medicare is a process, not a product.
Yeah, we'll take you down that road. We probably won't hold your hand because of the coronavirus, unless we have a lot of
gloves.
We'll wear gloves. Speaking of gloves, I haven't had a massage in the last like 3 months. I go to get a massage last week, and guess what? She's wearing gloves. So that's how crazy it is out there with the coronavirus. But anyway, thanks for tuning in. We're here to protect you, to give you some information, ideas. Listen, there's gonna be a lot of questions about everything. I don't care if we don't know the answer, for whatever reason we don't know the answer. If you ask us a question that we don't know, we're gonna get you the answer in a very timely way. We wanna make sure that we do the right thing. I've been here a resident on the Treasure Coast for over 34 years now. So it's important that we always do the right thing for our clients. Thanks for tuning in. Stay safe, stay happy, stay healthy, and we'll see you next time. Take care, everybody. Thank you.
Bye-bye.